Hi, everyone. This is Dr. John Mullins, the owner of Marshall Lifestyle Medicine. As many of you may be aware, the number one risk factor for the development of chronic disease is aging itself. Our practice is formed and is predicated on ways to help people extend their longevity, extend their health span, extend their lifespan. And it is our goal to give you the tools, the diagnostics, and the pathway to overcoming the inevitability of aging itself. And today I'm joined by a special guest, Hannah Wendt. She is the co-founder of TruDiagnostic. I've asked her to come on today and talk about some unique diagnostic testing tools that her company has available. It's one that I recently took myself just to kind of see how the process worked. So Hannah, I appreciate you coming today, and I'm looking forward to having just a very open conversation about what you do, the products that you offer, and then just kind of nerd out because our audience is one that kind of appreciates that. So thank you for coming.
Yes, I love it. Thanks, Dr. Mullins. I'm excited to be here.
So the way we were just having a little bit of chit chat before we started the segment, you mentioned to me that you're from Ohio, came to school at UK, did a biology background or biology degree from the University of Kentucky. Tell me what's happened since the completion of your studies.
Yeah, so I actually took a really unique position right out of college at a compounding pharmacy in Lexington, Kentucky. And they really specialized in peptide products. That's where my entire world was shifted. And I started to really understand this integrative cash pay healthcare space, right? We're so used to that sick care model. So that I remember my life like before and after that. That was such a big turning point. I then went on to do some work in the International Peptide Society. So we created kind of this group or forum around those products to help educate physicians on how to use these products. But one thing was missing, and that was a measuring stick to really say, hey, how are these products helping my patients? That was a really big struggling point for providers. So we all got together, multiple people from the team, and said, hey, what is the best biomarker, right, for all-cause mortality, death, and other diseases? And it's aging, as you mentioned in that introduction. And of course, you can go down this rabbit hole of, well, what's the best way to measure aging itself? And we actually came across epigenetics, which is what we measure at TruDiagnostic, and we'll talk a little bit more about today. So that was really the evolutionary of my career so far and how I got started in this space.
And how long were you with the compounding pharmacy before you got into the position that you're in currently?
Yeah, about 3 years or so.
Yeah, that's kind of mirrors my kind of onboarding into the space also. I mean, previously, before we got into the more diagnostic side, we were doing a lot on the therapeutic side. And I always had the same questions myself. I'm very metric driven personally. I like numbers. I like the way to graph things. And I didn't have a lot of testing that was available with the type of variables or biomarkers that I thought were indicative of where a person's current level of health were. And traditional testing, the type that you would get at your family practitioner, internal medicine, are not sufficient, were never sufficient to give people either peace of mind that what they're doing is successful, or the converse is also true. People would get scared to death based upon erroneous measurements that had nothing to do with aging itself or the prospect of longevity for them. So that's where I started getting into the more the advanced diagnostic side and how that is a starting point for a person that is looking for a future in the longevity space, and they want to know, what do I need to do based upon the cards that I currently have to overcome those tendencies, either genetic, epigenetic, lifestyle, whatever. Show me the path forward, and do so in a metric-driven approach. And that's kind of what I like to talk about with my patients, and I think what you're doing aligns with that perfectly. So tell us a little bit about TruDiagnostic. What exactly do you guys do? Maybe go into a little detail about the testing that you've provided for us to do at our office.
Mm-hmm. Yeah, TruDiagnostic, we've been around for about 5 years now, which is crazy to say. It seems sometimes a lot shorter, sometimes a lot longer than that. And we are really an epigenetic testing company. So epigenetics, epi, that Greek prefix, it just means above or on top of. We're really looking at how your genes are being expressed, right? What's being turned on and what's being turned off. And then actually, how does that affect your health, right? So we really got started in this space that has to do with aging, biological aging. That's really where the science starts. It was pioneered back in 2013 by someone named Dr. Steve Horvath out of UCLA. And what he really noticed is we can look at these epigenetic switches, these on and off switches for your genetics, and actually give you information about how you're aging. And that's really important, as we were talking about, because that's a baseline. You can take this test. It was our first flagship product offering called TruAge. So you can take this TruAge test at a baseline, look at all different pieces of information and ways as to how you're aging, and then start to implement lifestyle changes. Maybe it's more supplements, medications, procedural-based therapies to hopefully help you reduce that aging aspect and get you to the goals where you need to be. So we usually see, people taking the TruAge test every 6 months or so to track that progress or, maybe lack thereof with a provider's help. So with your guidance in the clinic.
Let's backtrack just a second, because I think for the audience, the listening audience, and maybe some providers that be listening, the difference between genetics and epigenetics. We come from Kentucky, you're from Ohio. There's always a big debate about why our healthcare outcomes in the state of Kentucky. What is the reason that we do so poorly? Is it cultural? Is it genetic? Is it epigenetic? Is it all the above? Is it access to it? And until just recently, or in the last several years, I was confused by the difference between what a genetic DNA profile looks like versus an epigenetic profile.
Yeah.
Could you go into that a little bit for our audience?
Of course, absolutely. So your genetics, this is going to be very different, right? Your genes, you're going to get 50% of your genes from your mother. You're going to get the other 50% from your father. These are set in stone. They are never going to change, right? So you may have you may have some genetic components that predispose you or increase your risk or decrease your risk for certain diseases or outcomes. So I'll give you an example for me in particular. I have an APOE3/4 gene. So I actually have an increased risk of neurocognitive decline as I become older, dementia, Alzheimer's, and I cannot change that genetic risk. Now, as it relates to patients and providers, this information is a little bit limited in terms of its clinical utility because you can't change it. You kind of just, know about this information. More knowledge is power and key, but you can't do anything to actually start to edit that genetic profile. And this is where epigenetics comes in and why it's so exciting, because you can actually start to alter the genetic expression levels of those genes. So no, I can't do anything to change my APOE3/4 genetic status, but I can actually implement some lifestyle factors to help me with the expression of those levels in particular. So we find epigenetics to be a lot more clinically vital for people because, again, it's that measuring stick. And we really say you can't manage what you're not measuring. So it's a way to kind of look at where your health is and where you're going in the future too.
And those individual decisions, I chose the word lifestyle medicine before I really knew that there was a college of lifestyle medicine, because I believed so wholeheartedly that the decisions we make ultimately define our final outcomes, and along the way, our level of happiness and balance, et cetera. And that's why I try to preach a lot to my patients about the importance of making very purposeful acts. But again, before these types of tests, it was a lot of times we were talking about was more anecdotal, so to speak. I mean, we all know that if we eat better, we should look better. If we sleep better, we should have less stress. But there's those type of lifestyle behaviors truly represent changes to our epigenetic profile.
Yep, you're exactly right. And it's funny because if you look at social media right now, right, and you see a lot of quotes like your DNA is not your destiny, or you are what you eat, or food is medicine, right, talking about this type of lifestyle medicine, they're actually describing epigenetic indirectly without really saying it.
Right, and I wish they would say it. I mean, I'm a member of the American College of Lifestyle Medicine, but they don't get into it in my opinion, enough on the scientific level for my liking. I like to know why food is medicine. Why, if I eat certain foods, what is that going to do at the biochemical level? And that's of interest to me. And the people that come to me oftentimes they're kind of read themselves. They do a lot of self-study and self-inquiry, and they need more explanation as to why eating so many courses of fruits and vegetables, what does that do? What is that really doing? At what level is it really working?
Yeah.
And I think that's important, in my opinion, when you're trying to make somebody who's pretty strong-willed, trying to modify their behavior, it has to be logical, in my opinion. And if it's not logical, then it's kind of hyperbole.
Yeah, they need to be able to see something tangible almost, right? Like the before and after effect of what their decisions are, or how their decisions are having an overall effect on their health. So that's why I really like the testing. Again, you really can't manage what you're not measuring, the quote by Peter Drucker. So it's one we use very often at TruDiagnostic, because I think it puts the power back in the patient's hands.
Absolutely.
And the provider too. You as a provider can only provide so much advice to the patient, right?
Absolutely. Well, I agree with what you just said, and I'm a big fan of metrics. I'm a big fan with metrics for running a business, running your life, running your health, and I tend to attract a fair amount of metric-driven individuals that they're executive men and women that they run their companies based upon numbers, and they do really well when they're provided with. We have a body composition machine in our office, the InBody machine. It doesn't lie. It's always correct, and people stare at that information. And what I'm interested in, so if I were to, I did your True Health and your True Age test myself last month. I was a little disappointed with the results that you and I already talked about, where it said my biologic chronologic age was the same. I was hoping it was going to be better than that. But if I were to repeat the test, does it then compare the two? Will it graph it or kind of give me some idea of improvement?
Yeah, absolutely. So you'll get the longitudinal graphs over time from time point 1 to time point 2. And then it'll even show you different factors which actually changed within that reporting metric.
Okay, that's
too.
great. So. And I think that's what our patients really, they want to see that what they do is doing something.
Yeah.
Maybe it's not translating into something objective that they can feel or the way their body looks in a certain way, but at the basic level, they know that what they're doing is results driven.
Exactly. And it's really about that cellular health too, right? They're going to be able to see it on a piece of paper. They're competing with themselves, and they actually want to see the metrics. They want to see what all the hard work they've been putting in actually looks like from a health standpoint.
Well, could you tell us the difference between the two tests that you are providing, True Age and True Health?
Yes.
If you wouldn't mind going through those with me. That would be very helpful.
Yeah. I already hinted a little bit at the True Age marker. So the True Age marker is really looking at biological aging as kind of this overarching category of health. It's really for those patients, I think, especially for yours, who want to increase lifespan, so how long they live, and increase health span at the same time. How many healthy years you have at the end of your life. Because in my opinion, that's maybe even more important
it's
than
definitely
lifespan.
More important. If you've never visited a nursing home, you would
Exactly.
know exactly why that is important.
Yeah.
And I use that example with my patients. Do you want those last 20 years to be in a nursing home with a diaper on?
Yeah.
Or do you want to be those last 20 years on a yacht, having cocktails on a veranda? And I know the answer for myself. So yes, knowing that information, I think, is critical decision making.
Yeah. So that's what the True Age test is going to give you. It's going to give you some different biological age clock measurements. So we call these things clocks. It's kind of what they were just coined and termed. We even tell you how quickly you're aging at this very moment in time. So we have metrics that kind of look backwards on your years, how you spent your previous lives, so to speak, and tell you where your aging is. But then we have some metrics that tell you more how you're currently doing in the past 3 to 6 months, because we want to really get a full picture of everything. And then you're going to use that information to say, well, am I on the right path? Or maybe I'm not. And here are the changes that I really need to make. So you no longer have to wait for these 40-year longitudinal trials to come out that are populational based anyways. This is true N of 1 precision-based medicine, where you can start to really key in on your patients' wants and needs and the changes that they want to see.
Precision medicine is something that a lot of people are talking about right now. I certainly think it's the way of the future for a select group of people that don't want to be included in a longitudinal study. Mm-hmm. They want healthcare that's pertinent to them. Mm-hmm. And how do decisions I make or they make, how's that going to affect myself? And the precision medicine, I think, for a select group of people is something that they really want. They didn't really have it wasn't around until in the last 5-10 years, really. And with the advent of what you're doing, I consider those certainly precision-based testing. What have you noticed, and with your statistical analysis of these types of tests that you're performing, are there three things that you notice that, if, let's just say, for instance, we did the test on someone and they did the results that they achieved were not the desired ones that they wanted. And I had to give them three lifestyle prescriptions, because we write those, that would have the highest impact on a future, testing that into the future. Do you have an answer for that?
I do. And again, why I love your company
I do
so
anecdotally.
much.
I was just curious what yours are.
So, it all comes down to lifestyle factors. We actually really do see those really moving the needle when it comes to the biological aging. I know what works for me personally, and I'll give you mine.
Okay.
Stress is the biggest factor for me.
Stress.
By far. And I actually got certified in transcendental meditation about 1.5 years ago. I'm not perfect, but I try to do 20 minutes in the morning, 20 minutes at night. I can just subjectively feel my stress levels going down. I'm a very high functioning, individual trying to run a business as well, like most of your clients probably. So that is my number one. Number two, I have to be working out in some way, about 5 to 7 days a week. I like to do a lot of weight training right now, where I'm at with my age. You definitely want to watch to increase muscle mass, decreasing that visceral fat. So definitely working out about 5 to 7 times a week at this time. And then lastly, I would say for me, that does seem to work very well too, is caloric restriction. I would say that's probably, from like an academic research standpoint, one of the number one things you can do to increase lifespan and health span, but you got to be very careful.
Yeah, how are you doing that? Are you fasting? Are you having some intermittent? How are you doing yours?
Yeah, just overall caloric restriction. So just decreasing the amount of calories.
Gotcha.
So yeah, I'll do about 1,800 calories a day. It's going to depend again a lot on your goals, workout regimen, et cetera. So those are my top 3 without going in too much depth about them.
Yeah, well, I agree with all 3 of those. I think that there's been a lot of studies about the role of exercise and longevity, and it in and of itself can prolong your life more than almost any other variable. I would have thought sleep would have been in there somewhere, because to me it seems so critical, and it's something that highly productive people do so little of.
I am weirdly a very good sleeper. So it's never been a problem for me. I have the Oura Ring. I track it. I've never had an issue with sleep. Now, I do have to watch. I am very cognizant of how I do it, right? I'm not eating after 8, 9 p.m. I can tell when I get worse sleep. So because I track it so closely, but I've always been a pretty good sleeper. And that's why it's not on my list. But I would say the 3 that I named plus sleep are like really the 4 core lifestyle factors that people should care about.
Yeah, that's very interesting. We have a 12-pillar thing, but sleep's number 1, exercise is number 2, nutrition's number 3, and it's just the basics. But despite the fact that those are so basic, it is there's so little talk in just the general medical community about focusing on things that for the most part are free.
Right.
Getting those 3 things in line really don't cost anything.
No, I think if you could be, very honest with yourself, right? Hold a mirror in front of yourself and say, this is where I know I'm struggling and I need help. And you're really able to focus on a couple of those. I know you mentioned the 12 top pillars. There are a couple other things I have outside of just those 4, watching your alcohol consumption, not smoking, insulin sensitivity, toxins, environmental exposures, right? The list goes on. And I'm sure your 12 pillars cover it all.
We do, but it seems like if people can't get the lowest hanging fruit first, it really doesn't make a whole lot of sense to move on down the list. And I give a talk frequently called Success at Great Cost. I tend to attract a lot of business owners, and their success comes at great cost to their mental resilience, their sleep, their nutrition, their fitness. All the things that we're talking about with respect to how to prolong a person's health span is something that they lack. And until you've given it to them in a metric format to where they can see it black and white, and then a roadmap, so to speak, on how to improve it. That resonates with them. But without that, it's just kind of talking, and it just doesn't, from my experience, it doesn't register.
Yeah.
So I have to be very precision medicine, about what it is they're doing wrong and how exactly to do it better.
Yeah, I love that. And actually, when you were walking me through that, for whatever reason, I had a case study pop into my head too, which was really early days at TruDiagnostic, where I spend a lot of my time on the phone with healthcare providers, and there was a provider in particular I was speaking with, and her husband took the test. Entrepreneur, heavily invested in these companies, very high stress, very high functioning. They just had a couple children, so they were wanting to do more of this like lifestyle medicine and really make sure they were, setting themselves up for success. Awful metrics. I was very nervous to talk to, the wife. Accelerated biological aging. He came back, tested a year later. He had actually stepped down from that company. He was fortunate enough to do so and sat as more of a board member on there. Started incorporating more golf, just like really unloading that stress, and changed his diet too, and had a phenomenal results.
Yeah, that's a very good case study, and one that I'm going to try to borrow from you, because these things are reversible. I had a 20-year career before I did this in the ER world at a very, very high level, and highly functioning people are able to be highly functioning because of certain personality characteristics that also work against them when it comes to health span, lifespan, balance, etc. And that's why I'm interested in employing this testing in that particular client type, just so I can get some. I'm interested in the data myself. I want to compare it to what I'm seeing in front of me, compared to what it looks like on paper, and figure out how to then maybe foresee those kind of epigenetic things just in my way I'm observing them, because I have enough experience to see it.
Oh yeah.
So I'm interested in getting lots and lots of information from my current patient base in this world, so that I can better advise them on what I notice has made the biggest difference when these folks have come in with the negative attributes, so to speak, but they are reversible, and here's how they did it.
It's going to be really nice to see it from your point of view too, and all of the trends and associations that you're seeing, because you're going to really start to know what works in that certain client profile too.
Sure.
And kind of the individual specific changes that are going to have to be made. So
I'm
it's
getting ready to do it for myself based on the results of that test. I mean, I'm a high performer, at least I like to think I am. And when I saw those results, I was shocked. Not only shocked, I was mad at myself.
Well, let me add some context, because I think it's important too. You just said, you were in the emergency department and space for 20 years prior. That's going to, all add up. And we actually see that trend with a lot of our physicians, where they may be much older, right? Because they kind of had this historical aging where it was very, very high stress. And then they get into this space of lifestyle, precision, integrative medicine, and start to really turn kind of their life around in that way. And then you start to see kind of their pace of aging become a lot slower. So their current aging looks really great, but they were just in such that different environment earlier on.
This would be a great test to administer to doctors in general. And in my future, I foresee a day where I'm doing more in the medical space for medical practitioners, because they don't even know what we're talking about right now. I would say 99% of doctors are unfamiliar with what we're talking about. They're smart enough to understand it, but they were never exposed to this in college, medical school, residency, postgraduate training. We're just never exposed to it. But I'm interested in seeing how I can employ these tests, and then giving them lifestyle prescriptions to alter their trajectory, and have that be something that we're proud to administer.
Yeah, we're so excited to partner with you all and have you offer this testing to your patients too.
Yeah, well, I'm going to go on with some other questions for you. We had some from our practice. They were put together for you. We talked a little bit about epigenetics and about the true age. There was a question about how do your algorithms, how did you develop the algorithms and the studies that they used to put these tests together? Is that something you feel comfortable talking about?
Absolutely. Yeah. So one thing that makes TruDiagnostic very different from maybe other companies who are running biological age tests is we only use peer-reviewed algorithms or biological age clocks that have been published in these types of studies. So our three main aging algorithms, we have one called Omic M-Age. That one was actually published with Harvard in about October 2023. We released Symphony Age, which is the aging of the 11 different organ systems. That one was published with Yale. We started offering that one in June of 2024.
Okay.
And then the last one is this Dunedin PACE algorithm. We actually exclusively licensed that one from Duke and Columbia University. We've had that for a while now, probably 2022 even, maybe a little bit before that. So we are really behind the science. We have to believe in the science first.
And I think that's really important as we're progressing as a medical community into the fringes of longevity medicine and some of the things that fall into that category. I think it's critical that doctors, scientists, people in the diagnostic space are truly using science-based research and not something. It's very easy to fall off the other side of going from something that's mainstream but progressive to something that looks just completely too far out there to be considered mainstream by most people. And I want to make sure, and I'm glad that you're saying all that because that's important to me.
It's very important. And we still want people to know this testing is so new, right? It's very cutting edge. We're learning a lot, but there's a lot we already know about it too. And we know that this has to be really vetted in the science because then we can actually publish on these findings with N of 1, right? With the actual testing and say, this is what worked for this person, maybe not, this for another person, and actually dig into, okay, well, how specific can we be? So we do predictability studies looking at, again, odds ratios and hazard ratios. So how are we able to predict disease and death from these markers? We publish a lot of reliability studies. So there's a lot of benefits to using the epigenetic testing.
This is fantastic stuff. This just goes part and parcel to the lifestyle medicine that I've been trying to promote. And to have a tool by which we can actually show what they're doing is actually benefiting themselves on a genetic level or epigenetic level, cellular level, so to speak, without waiting to the day that your kidney function goes out of whack or your liver function. Those are late markers, very late markers of how you're actually aging. If you would agree, I'm sure. And unfortunately, that is what mainstream medicine uses as their screening to tell people whether they are or are not healthy.
Right.
And it really is not indicative of their health.
Yeah. It's all about I think you were hinting at preventative too, right? So if we're able to take this test and say, okay, you're aging a little bit faster, that's okay. We know about it. Let's act on it now.
Sure. And I think that the people are smart enough, if provided with the right information in a collaborative format, to make decisions in their best interest, provided that it's done so in a way that they can understand and they can, it's metric driven and it's not just something whimsical. I respond very well to logic. And a lot of people that come to me do so as well. So if I can lay it out in a very logical manner, that's something that connects with the way their brains work. And people, I think this is going to go a long ways. This is going to be part of our overall advanced diagnostics program that we're offering at Marshall Lifestyle Medicine, because I truly believe early detection and gathering as much information to know what cards you have so that you can play it properly. And nobody wants, I do not want to be a low performer. And if I knew I was holding just a couple good cards and there was a way to get the other three, I would do that because that's just the way my brain works. And I think high performing individuals that are interested in living or adding healthy decades to their life, they want to know, what do I need to do? And then they will do it.
Right. And using those cards to your advantage, right? Saying, hey, this is what my profile looks like. These are the levers, the dials that I can pull and turn and push to really optimize to be at my peak performance.
And I use this a lot. And we were talking before the segment about women, and a woman who knows that they are going to live a long time. That's a totally different strategy than someone that does not believe they're going to live a long time. And I use that example. Do you want those last 20 years to be dependent on others with osteoporosis, with Alzheimer's disease, in a nursing home for the last 20 years of your life? Because we already know you're going to live a long time. Or are you interested in strategies, hormonal therapies, peptides, supplements, lifestyle things that can allow you to have those last 20 years of your life optimal? And that's why I like using these kind of things in that context, because women are ones that tend to get, I don't know why, but they tend to get misinformation more so than even men do in the anti-aging space.
Yeah, I think you're right, and I want to be on that yacht when I'm older.
I do. Well, I do too.
Spending my life there.
I do too, and the patients that come to me, I think they want that as well. But they just want real information that they believe is accurate, so they can plan accordingly.
Yeah, and track those outcomes too. Like you said, if I do the test at baseline and then I follow these things, very logically going to lead to this outcome, right? So something that's easy to follow and makes sense, I think, is almost too much to ask, but it shouldn't be. With this type of testing now, it's available.
It should not. Do you see anything on the horizon with new testing that you guys might be experimenting with or working on in the future for people?
Yeah, so we talked about the TruAge test. We also do the TruHealth test. That will be in that combination package that you're offering to patients. And that's more of that micronutrient panel test. So your vitamins, aminos, antioxidants with a lot of interesting health and systems conditions. So we even look at metabolic function, inflammatory markers, even things in the NAD metabolism, ketones, toxins, those forever chemicals. So talking about more a lot of those environmental exposures. And we can even quantify things like blood pressure through epigenetics and supplement levels too. So you're really getting everything with both products. You have TruAge, the aging side, and then just a traditional micronutrient like health systems and conditions panel with TruHealth that's telling you true deficiencies and exactly what you would need to supplement with.
That's golden. I think the supplement world in and of itself is very confusing, and people buy lots of them without really the knowledge of knowing what they're putting in their body and for what. And they really don't have any way of tracking to see what they're doing is actually helpful or not.
Yeah.
I would much rather be precision medicine. Based on this is what we would recommend. And then we have a manner by which we can go behind it and make sure that what they're doing actually is beneficial.
Yeah, you're exactly right. And we've done pretty large studies on this, showing that a lot of supplements really aren't going to help people who are extremely healthy already,
Sure.
right? It's really going to go back to those lifestyle factors that move the needle the most, unless I would say you are actually deficient within that supplement. So that's why we really like the TruHealth report. But to answer your question more directly about kind of what's on the horizon, like big picture, we're getting into starting to be able to even predict chronic disease essentially with these markers. It's not in product form yet. It will be hopefully within the next year or so. But again, we have medicine to really treat cancer and chronic disease, but you have to be able to diagnose it early.
Sure. I'm a big fan of early detection as opposed to the way that we practice medicine in the United States, which is reactive, just waiting till you're sick and then prescribing a treatment program that may prolong your life a short amount. But early detection, we already have the tools available to do these tests, and the general public, for the most part, is just not familiar with them.
Mm-hmm. Yeah, I'm really excited about when we have that ready. I love all of our products right now, the TruAge and the TruHealth, but even these chronic disease predictors, it's still going to be the same exact process, which is just, we haven't talked about yet. It's just a little kit. You get it, you prick your finger. We need a teeny tiny blood sample. You send it back to our lab and you're getting results back in a couple of weeks. I mean, it's really easy as
that's
that.
Great.
And it's super accessible.
Any test, again, has to be easy, right? It can't be cost prohibitive. And we have the test that Hannah is describing at all 4 of our offices currently, and we also have the ability to send it virtually to 44 states that we currently provide Marshall Connect virtual services to. And then remind me again about how long it takes to get the results back once received.
Yeah, about 2 to 3 weeks when they arrive in our lab in Lexington. So we try to keep it as close as possible, that 2-week mark.
And if I remember correctly, it was just a finger prick test, right?
That's all it is.
So a person should be able to do this themselves at home.
Yep, very easily.
Yeah, and so that is also for something that I really like is the fact that it's easy to perform. Mm-hmm. It's not cost prohibitive, and it's something that you get a tremendous amount of information that you would not get from a traditional yearly exam with your doctor that gives you false reassurance that everything is good.
Mm-hmm.
Right?
Yeah. And that's what the epigenetic markers are so great at doing too. They're actually really great kind of at predicting the future before traditional markers can even detect them too. So just another reason to love epigenetics.
Yes, absolutely. So, I find this very interesting personally. I opened my practice in a large part for myself, as a lot of doctors that go into healthcare tend to do based on previous experience in their own families. I've had folks in my family that died prematurely, in my opinion, most part related to lifestyle or cultural decision making. And I'm interested in whether or not those tendencies translate into my generation and my future generation. And I have a theory that it will not, provided that I at least have the information available to make lifestyle modifications, and then early detection techniques to catch things before they're at an ominous level.
Yeah. Yeah. I think this testing is really going to open a lot of people's eyes, right? It's going to be, again, a mirror that they can look at. It's going to be something tangible where they can see the results. They can see basically the consequences of their actions up until this point. And then they're given the choice to say, I can keep going on that trajectory or I can make some changes right now.
Absolutely. Well, I have found this to be a very stimulating conversation for a lot of different reasons. And Hannah, I want to thank you for coming on and sharing all of your wealth of information and knowledge about this. As I'd mentioned previously, we have this test available at all 4 of our Marshall locations, and anyone that we're treating virtually in 44 states, we have the ability to send you the test for your to get some information, so that in lieu of in preparation for the conversation we're going to have about your longevity pathway. So again, thank you, listening audience. Hannah, thank you for participating in this conversation, and we look forward to having future conversations with other new and exciting tools at that time.
Yeah, thanks, Dr. Mullins.
Thank you so much for coming.